None of us realized what, the extent of her, disease was at the time.
Until it was too late to even slow down the spread of her cancer. Erick LaPorte had been a longtime smoker who kicked the habit, dying within months of her diagnosis.
Her husband, also a longtime smoker, would end up dying of the same disease 5 years later.
Doctors were able to prolong his life, allowing him extra time with his family, all because of a free screening.
It's none.
Charlie's a good boy, loved by everyone in the LaPorte family.
Really love belly rubs.
Charlie was once Grandpa's beloved dog to help cope with losing his wife.
Have all these plans for doing things once you retire and to not make it.
Still shocks Erick LaPorte. He always pictured his kids growing up with Grandpa and Grandma around.
Good boy.
But that dream came to a tragic finale last October when LaPorte lost his last living parent, both dying just 5 years apart to the same ugly disease.
This is what I was, scared of. And I know that they had all kinds of plans for grandkids. You gonna open wise with Lily?
Did Lily have the best time?
No one knew at the time that this would be the last Christmas with LaPorte's mom, Janine, in 2014. Days later, she would be diagnosed with stage 4 lung cancer. And in the fastest 4 months of their lives, she'd be gone.
Things were, kind of dismissed. They weren't taken seriously to have a screening.
Janine was only 56 years old. She had quit smoking before her diagnosis and started having problems. Complications, LaPorte says, were considered common symptoms of kicking the habit.
None of us realized what, the extent of her, disease was at the time and how, how critical it really was.
And when his dad started showing signs of something wrong, they tried to get ahead of what would eventually be another devastating diagnosis.
Really bad deja vu when it hit my dad too, but we saw the difference that some of those things could make.
LaPorte says an early lung cancer screening made a world of difference. Despite it being a more aggressive cancer, the earlier detection gave them years with his dad as opposed to just weeks with his mom.
Because they caught it early, even with it being more of an aggressive cancer.
The U.S. Preventative Services Task Force is changing who it considers to be high risk by changing who can get screened. You no longer have to be age 55. You can get screened now at age 50. You no longer have had to smoke a pack a day for 30 years. You now qualify if it's within 20 years. And if you're a current smoker or you've quit within the last 15 years, you qualify.
There's such a benefit to catching cancers early, especially deadly cancers like lung cancer. They felt that they could open up the parameters of the screening a little more.
Ann Worley, a thoracic nurse navigator at Covenant, says private insurance companies have up to a year to recognize the new guidelines.
The biggest problem is we're waiting for those to take effect. When the insurance companies recognize the new guidelines, that will be when we can lower our criteria here at Covenant.
Criteria that could save more lives.
This is a painting that I painted. I copied it from a picture of my grandma and grandpa's basement.
This is as quiet as our house has ever been.
If we would have gone through something like this before my mom and realized some of the symptoms or realized the screenings that were available, maybe we would have pushed more for that. But we didn't know.
And if you have any questions about screening, call the number on the back of your insurance card and they can let you know whether or not it's covered.